Behind every person being cared for in a hospital or at home, there's this hidden document, a kind of master plan that guides every single decision. Today, we're going to pull back the curtain on that plan. It's called the Nursing Care Plan, and it's the essential blueprint that turns what can be a really complex health crisis into a clear path forward.
And that's a huge question, right? When someone is dealing with a whole tangle of health issues, emotional stress, and social challenges, it can all feel, well, pretty overwhelming. So how do you possibly bring order to all that chaos? The answer, it turns out, is in a very structured, very deliberate process. To really understand just how powerful this process is, we need to see it through the eyes of a real person. So let's follow a case study. Let's meet Mrs. Eleanor Green. Okay, so Mrs. Green is 84 years old, and her health it's like a really complex puzzle with a lot of interconnected pieces. The goal of her care isn't just to treat a list of conditions, it's to support her as a whole person. And to do that, well, every little detail matters.
Just look at how quickly this gets complicated. You start with the medical stuff, right? Hypertension, diabetes, but then you layer on the cognitive issues, memory lapses, a bit of depression. Then add in the physical challenges. She's had 2 recent falls, she's in pain, she's losing weight. And on top of all that, she's socially isolated. Every one of these things impacts all the others. This is the puzzle that needs a plan.
So, when you're faced with all of that, with Mrs. Green's entire situation, where do you even start? Well, you start by building a blueprint. This is where the Nursing Care Plan, or NCP, comes into play. It's the tool that brings structure and real strategy to her care.
The best way to think of it is like a roadmap. And it's not just some simple checklist. It's a formal process that helps identify exactly what Mrs. Green needs right now and what risks she might be facing down the road. And from there, it lays out the specific actions the whole team is going to take to help her.
And this is absolutely crucial. The care plan becomes this central communication hub. It makes sure that the doctors, the nurses, the therapists, even Mrs. Green and her family are all literally on the same page. Everyone is working together towards the same goal, making things better for her.
Now, a plan this important doesn't just appear out of thin air. It's built using this really systematic 5-step process that's designed to take all of that complex information about Mrs. Green and turn it into a clear, actionable strategy.
And the key thing to get here is that this process isn't a one-and-done deal. Nope, it's a continuous cycle. As Mrs. Green's condition changes, the team keeps circling back through these steps to update and refine the plan. It's really a living, breathing document.
Okay, so here they are, the 5 steps that form the backbone of the entire care plan. You've got assessment, diagnosis, planning, implementation, and finally, evaluation. Let's walk through each one and we'll keep using Mrs. Green as our guide.
All right, everything kicks off with assessment. This is the big information gathering stage. This is where nurses really dig in to get the full story, to understand Mrs. Green's complete situation, from her medical history all the way down to her personal fears and what she wants for herself. During the assessment, nurses collect 2 different kinds of data. First, there's subjective data. That's what Mrs. Green tells them herself. Things like, my knees hurt, or I feel lonely. Then there's objective data. That's the stuff the nurse can see and measure, like a blood pressure reading, or that she's lost 3 kilograms. You absolutely need both to get the full picture. So what happens with all that data? Well, it gets analyzed to pinpoint the key problems. That's the nursing diagnosis. And from there, the team moves into the planning stage, where they work directly with Mrs. Green to set really clear, achievable goals for her care. And here's the thing. These goals can't just be vague, wishful thinking. They have to be SMART. It's this fantastic acronym that makes sure every single goal is specific, measurable, attainable, relevant, and time-bound. Here is a perfect example. See, we're not just saying, let's improve her nutrition. No way. The goal is specific, gain ½ kilogram. It's measurable, it's attainable, it's totally relevant to her weight loss, and it's time-bound, within 2 weeks. Now that is a goal you can actually track and work toward. All right. So with that assessment done and the goals all set, it's time for the action steps, implementation and evaluation. This is where the plan jumps off the page and starts making a real difference in Mrs. Green's daily life. So based on that assessment, the team has zeroed in on 4 main problems for Mrs. Green. And notice how they cover the whole spectrum. You've got physical safety, nutrition, skin integrity, and her emotional well-being with that social isolation. And for every single one of those problems, the plan lays out a specific nursing action,
or what they call an intervention. To lower her fall risk, they'll help her walk. For the malnutrition, they get a dietitian involved. For the isolation, they'll schedule family calls. These are direct, practical steps, the plan in action.
And hey, remember that cycle we talked about? This is where that all-important evaluation step comes in. The team is constantly asking, is this working? Is Mrs. Green getting better? Has something changed? If a strategy isn't getting results, they don't just keep doing it. They go back, they reassess, and they adapt the plan. Good care is always responsive care. You know, when you step back and look at the whole thing, it becomes clear that the nursing care plan is so much more than just administrative paperwork. It is really the very heart of what person-centered nursing is all about.
So what does this blueprint really accomplish? Well, it ensures safety by getting ahead of risks. It guarantees clear communication, so the whole team is pulling in the same direction. It creates consistency, but most importantly, it makes sure that the care is truly person-centered, that Mrs. Green's own values and preferences are right at the heart of every single decision.
When it comes right down to it, the nursing care plan is the amazing tool that takes this chaotic jumble of symptoms, data, and feelings and transforms it all into a coherent, compassionate plan for a whole person.
It's the thoughtful, invisible structure behind every single compassionate act. So the next time you see a nurse caring for someone, you'll know there's a detailed, dynamic blueprint guiding their every move. What will you notice differently now?